Doctors are seeing an increase of children in hospitals with viruses like the flu, colds, and RSV throughout the country. RSV cases have reached their highest level in the last 5 years. So our viewing area is already in the peak season of this virus, RSV. Dr. Mobeen Rathore, Chief of Pediatric Infectious Disease at Wolfson Children's Hospital, joins us this morning via Zoom to talk a little bit more about what parents at home need to know. Good morning, Doc. Thanks for being with us.
Thank you for having me.
So would you explain what RSV is to our parents who are watching?
Well, RSV is a respiratory syncytial virus, which is an infection that occurs usually in the winter months from October to March in all of the United States. In Florida, the season is a little bit prolonged, maybe usually from September to maybe April or May. And it's an infection that almost all children have by the time they turn 2 years of age.
That said, though, there are particular age groups, though, that are more susceptible, if they should catch this virus, of having to be hospitalized. Would you explain?
Yeah, so the children who are at the highest risk are usually the children who are prematurely born, or those who have respiratory lung problems, or who have heart problems, or have immune problems. Those children are, when they get the infection, they are at higher risk for having a serious disease and being hospitalized. Now, in the last few years, the RSV season has been a little bit topsy-turvy, and as last year it started sometime in May, this year it's actually started in July. And what we do for these little babies is we give them, the little babies who are at high risk for serious disease, we give them a medication which helps prevent them getting the infection.
So, and I just want to be clear, do older Americans and older adults have to worry about this as well? It's not just in young children?
Yeah, so anybody can get the RSV infection. You and I can get it. Elderly are also at an increased risk. In fact, elderly have a higher rate of mortality and morbidity with RSV. The difference is that the younger children, when they get it, it's a little bit harder to sort of manage them. You and I, if we get it, we'll get it like a bad cough or a bad cold. And because the babies, especially the premature babies and those with underlying heart and lung conditions, can have difficulty fighting this infection with smaller airways, they can have a bigger challenge dealing with this infection.
And it is really very frightening too, you know, if you've ever had a little one with RSV, because they're having trouble breathing, and it's very startling for a parent. That said, what are the symptoms, Dr. Rathore?
So the symptoms of RSV can be very much like a cold-like symptoms. You're not going to be able to differentiate just by looking at the baby that they have RSV or they have just a cold. So that is why we have to test the babies for that. Now, we know that in the RSV season, which we are in right now, when the little babies, when the infants, when they have infection that looks like a cold, they could have RSV. Now, I want to remind your viewers that most children with RSV do just fine. They'll have like a cold, and then they'll get over it and they'll get better. So it's a small number of children who are going to get sick. Now, the other important part to remember is, I alluded to earlier, it is those children who are at high risk. But we also know that most children who get hospitalized are not in that group. These are otherwise healthy children. So it's a wide spectrum and difficult to predict.
And I think that what's important here also is that, as you pointed out, you know, it's a small portion of the community perhaps, but the reality is that, you know, as parents, and my kids are teenagers now, you know, it feels like a 2 or a 3 or a 4-year-old always sort of has a runny nose and has a cold. At what point do you decide, okay, this is more than that and I need to take them to the doctor, or maybe even the hospital?
Yeah, so I think as I always say, it's your parental common sense. If your child looks ill, regardless of the time of the year or the age of the child, you need to consult your pediatrician. Call your pediatrician, ask them. They can help you guide whether you need to come in to see them or there are some things you can do at home. Now, of course, if your child is looking seriously ill, as looks very sick to you, take them to the emergency room at Wolfson Children's Hospital or one of the other freestanding children's hospitals, because we can take care of the children there. So I think use your usual common parental sense that most of the parents have, in which you can decide, okay, now I need to take my child to the emergency room. If your child looks sick, do not wait to take them to the doctor.
Dr. Mobeen Rathore, Chief of Pediatric Infectious Disease at Wolfson Children's Hospital, joining us this morning. Thank you for your time. We appreciate it.
Thank you so much, Jen.